Welcome back to Studio 10. It's so nice having you with us this Friday morning. In today's Healthy Living, we're talking about chronic kidney disease, and this is very serious. Chronic kidney disease has been referred to as a silent epidemic because many times people who have kidney disease don't even know it. I want to introduce you to Ryan Smith. She's an RN with DaVita Dialysis. Ryan, is it true that 1 out of every 10 people in the United States has kidney disease?
It is. So it's really alarming to think that probably someone that you know has chronic kidney disease and doesn't even know it.
So what is kidney disease?
Kidney disease is where your kidneys no longer work the way that they need to work to maintain your overall health. So they can't filter toxins and can't filter waste and fluid the way that they once did.
Okay.
So the good thing about chronic kidney disease is that it can, if it caught early enough, the progression can be slowed or stopped altogether.
Now you're probably sitting there saying, am I that one? And the thing is, as I mentioned, some doctors call it the silent epidemic because most of the symptoms are things that we all experience every day. For example, sleepiness, puffy eyes, sounding familiar, also back pain, swollen feet or ankles. Maybe you stand on your feet all day, maybe you wear heels at work all day, so you just totally think this is normal. So how do we know if we're that 1 out of 10?
So the leading causes of kidney disease are two things that so many people have: diabetes and high blood pressure. So if you have those things, especially if they're uncontrolled, then it's likely that you may have some damage to your kidney. So it's super important to recognize these things and start treating them and get them controlled so that no further damage to your kidneys will occur.
So those are the two main conditions. That's who's more at risk.
Of course, if you've got some, cardiac disease, or you've got a family history of chronic kidney disease, someone that you are related to that maybe was on dialysis, then that would put you at risk. Just being over the age of 55 actually predisposes you to have some damage to your kidney.
Now, you mentioned earlier, if it is caught early, it can be treated. How is kidney disease treated?
Well, kidney disease, what we do is we have a class, and that's the class I was kind of speaking with you about. It's called Kidney Smart. We bring these patients into this class. It's a free class for the community, and we talk to them all about medications, over-the-counter medications that can damage your kidneys, or prescription medications that can damage your kidneys. We talk about diet. We talk about the things that you can do for your diet to prevent your diabetes from worsening or your high blood pressure from worsening, just how to control those symptoms. So what we do is we basically treat the condition that caused your chronic kidney disease. Now, if chronic kidney disease progresses, it does eventually, lead to kidney replacement therapy, which would mean a kidney transplant or kidney dialysis.
But there are things that we can do now to help prevent getting kidney disease.
Correct.
So some of those things, you mentioned diet.
Yes, diet. Just making sure that if you have diabetes that you're checking those blood sugars regularly and taking your insulin as prescribed. Really just good follow-up with your physician is half the battle right there. And that's kind of what we do in the class. So we teach you how to ask those important questions at your doctor. How many times have you been to the doctor and you maybe have 5 questions you want to ask him, and you go there and maybe you're nervous or you feel rushed or you just forget and you leave there and maybe you didn't ask all those important questions. So this class, we're going to go over every single lab that your doctor's going to go over with you. We're going to tell you what the lab is, what it should be, what it means, how to help you get it better, so that you've got a lot of tools to go to your next doctor's appointment and just say, hey, what is this, and this, and we're going to help you track it and just kind of make you really accountable for your own health care.
And you offer classes at DaVita Dialysis. You guys also go out into the community.
We do. So we have classes. You can go to our website. We can go to DaVita.com, and there's a link there, or you can go to KidneySmart.org, and those links are also going to be on your website this afternoon. You can sign up for a class, but we also, if you've got a church or some kind of men or women's group or a health fair or something, if you contact me, my team and I will be happy to come out and do a class for a group. We're really trying to get into the community and just get everybody aware. It's really scary to think that 1 out of 10 people are affected by this, and likely the worst scenario is that we find out about it when it's too late.
Right.
So.
Well, Ryan, we really appreciate you being with us this morning and sharing this very beneficial information. And if you would like to learn more about kidney disease and dialysis, DaVita offers the class that Ryan was talking about to people who have been diagnosed with kidney disease, and we'll make sure it's easy for you to find that information on our Studio 10 page on fox10tv.com. All right, coming up, how about some music?